I think that in the past we have always thought that regulators or clinicians were absolutely able to judge what risk and benefit is. And I think that was not even with bad intentions. We just didn't question it. And that was okay as long patients didn't speak up. But then all of a sudden there were patients who were not happy with decisions that were taken. And that led to the realization that actually a patient has a very different perspective of what risk and what benefit is. Now in melanoma we see that very clearly. If you're served a diagnosis of 6 to 9 months to live, and this is what we used to have for a stage 4 patient, your willingness to accept risk is very different from the one of a healthy person who expects to live another 30 years. And I think that we're now moving towards a process that better incorporates these different perspectives, because there is no such a thing as right and wrong, there's just different. And the art or the challenge is, how do we capture that? So what we have tried in our own network, in the Melanoma Patient Network Europe, is to simply try and measure what patients truly think. And we could already see a difference in the thinking of stage 4 melanoma patients and the carers of these patients. And our advocates thought yet differently again. So I think the take-home message out of that is that one really has to go out and measure and try to understand and try to take the own bias out. And I think that would be my take-home message, that we have to up our methodological game in truly understanding what matters to patients.